Good morning to every one of you. Okay. So, as Dr. Javasha has already told you, the skin, one side difficult to treat, another side is our rosy and roti, because the patient who comes to us with the skin problem will remain with you forever as long as you want. But how he will stay with you? You have to show some result, and that is most important. And as I know that I have been treating the skin cases for last 15 years in our hospital. We have our MD specialist and I as a homeopath sitting together. He is there just to assess how the patient is responding. No antibiotics, no steroids, no antihistaminic, only his judgment that how the disease, whether it is going deeper or it is improving. And with the homeopathy alone, we are just managing. And I can tell you the result, the diseases which are known as deadly diseases, the persons who are avoiding their presence outside, the social problems, because the problem is on the face, problem is the hand, they feel, just they avoid the company. How it will be there? Vitiligo is a problem, because they say that if the vitiligo is there, then my daughter, my son, he will not get married. The people are going to reject all this. So all these problems, and I can tell you that if you are sincere, if you are really sincere about patients, then you can just treat. Let me tell you before this lecture, because I was busy with something, and Dr. Javasha told that you have to take this lecture, and this I have prepared in 2 days, right? Just 2 days. I don't know how it will go, because it depends upon your response, but I can tell you, if you get some idea, at least 5% out of this, and you will find that homeopathy is very simple. Very simple, I tell you, because as I tell you, and I know my students, they are not practicing homeopathy. So it is very difficult, because today if you see the world, we are in 21st century. It is growing very, very fast. And our students, not only students but our patient also, they want that a thing should improve immediately. Is it possible? The patient comes, they say, oh, homeopathy is very slow. But I tell them, no, you are absolutely wrong. Tell me how long you have been suffering from this. Oh doctor, for 10 years I have been taking medicine. As long as I take medicine, it improves, but again it comes. And the size, the progress, the lesion goes on increasing. Is it that other systems are working? No. Then I explain, like if you start homeopathy, the thing which you are suffering for 10 to 15 years, and after some time, not immediately, suppose the patient comes today, I will not tell how much time I will take, but after 2 or 3 follow-ups, then I know how best my medicine is working. Then I can tell you, see, you just give me 6 months and I will show you the results. And these results which are there are long lasting. It is not that the moment I stop medicine, again the disease will come. No, not at all, right? But for that, I tell you, if suppose we go 10 years back about what skin problems. So I used to see that the patients from lower community, lower state of life, from jhopadpattis, illiterate, having unhygienic problem, they used to come to us. And most of the problem, when in 1973, I used to attend Cooper Hospital, which was nearer to our hospital, and we used to see that number of patients, 100, 150 patients in one OPD, and those skin specialists, what diagnosis they used to write? SBSD. We used to ask, sir, what is the full form? SBSD. Oh, some bloody skin disease. What was the diagnosis? Some bloody skin disease. That's all. And what? Because for them, any disease, anything, first they will give the local applications, then they will give the steroids, then they will give the antihistaminic. If suppose some suppuration or pus, what they will give? They will give antibiotics. That's all. And that is what was happening. Most of the cases of STDs, most of the cases are scabies, all these diseases were there. But today, now if you see which community, what type of patients, all intelligent group, all educated people, rich people. Why? Because now the change. Why this change? Because I feel the lifestyle, the change in the lifestyle, change in the eating, all this, and all this ultimately is because of stress. And that's why I told you that the stress, which is the most important. As I told you today, everyone wants to achieve everything very fast, right? The comparison, oh, he has got Honda City, why I should not have, right? But they don't know how the Honda City will come. And that stress, working. You see anyone in Mumbai, whether you are in the railway station, whether you are in the train, whether anywhere, what is the state of their mind? They are always in a hurry. They are running. They are not walking. They are not at ease. And this stress, because they know that if they reach home back in the evening, the wife is going to ask, oh, I want this. The son is going to ask this. And because of this stress, all these problems of the skin, because I know that when these problems, a person who has the skin diseases because of stress, they go to the allopaths. What they do it? They give the local applications. And what will happen? These external diseases, which are being driven out by vital force, that sparing the important vital organs, okay, initially let it come out on the skin, right? And when these doctors, our modern doctors, they treat with this kind of ointments and antibiotics, what happens is this disease from the outside skin is driven inside, what we call it suppression. And that's why the persons now suffer from so many problems. They may suffer from liver problem, lung problem, kidney problems, heart problems, or they may have CNS problem. And that's why the chronicity of the skin diseases are very important. They go on treating. Similarly, when such patient comes to us after a long time, and the new homeopaths who have just started their practice, what they will do it? They are always in a hurry. Oh, I'll show the results, right? I will show the result because this patient is suffering from so much time. What they will do it? They will just do here and there, 1, 2 symptoms here and there. They'll give 1, 2, 3, 4 medicines because they don't have time. They don't have time to take the full case history and prescribe the constitutional. And this young, immature homeopaths who will give these medications which are not really indicated, they are not even similar medicines, what will happen? Again, a kind of palliation. And if they go on doing palliation like this, what will ultimately result into? The suppression. And again the bad name comes to a homeopath, right? What homeopathy is doing? They will not blame the homeopath who is treating this, but they will blame homeopathy. Homeopathy bahut slow hai. So what they say? Homeopathy is very slow, but it is not so. That's why, seeing all this scenario for so many years, I thought, let us work on this, because this is the most important aspect what we have today to have our good living outside with some dignity, or that the skin diseases and the homeopathy is wonderful. The advantage with us today, that whatever the modern medicines they are treating the skin diseases, there are so many side effects, right? The patient's only itching is improved, the disease is improved, but the disease remains out, inside, and when they stop the medicine, again and again they are coming. Similarly, if you go to the Ayurveda, same thing happens, because the medicines are very costly. The restrictions are so much, and the patient cannot avoid or follow those restrictions. That's why we homeopath now have little more the responsibility to deal with this skin problem. And seeing all this, I have now I am going to discuss how the skin diseases which are chronic in nature can be managed